Okay, so I checked the provider orders, and today we're going to be inserting a catheter in the patient. The catheter kit is intact and not expired. It's size 14 French with a 10 milliliter saline balloon syringe. Okay, so we'll get started. Knock, knock. Hi, I'm Emma. I'm going to be your nurse today. Provide privacy. So today we're going to be inserting a Foley catheter, and this is just to help empty your bladder as you're not able to go use the bathroom right now. So first I'm going to wash my hands and ask you for your first and last name and date of birth. Okay, and before we get started, I'm also going to raise the bed to an appropriate working level. And it's going to be above my waist. And I'm also going to lay your head back as we do this procedure. It is a sterile procedure. So once I get that up, then I'm going to lay your head down. Okay, and before I get the sterile field ready, I would make sure my hands are washed and put on clean gloves, and I would do her peri-care. So I'm going to get you uncovered. And I would just spread her legs a little bit, what she could tolerate. And then I would have clean hands and clean gloves, and I would just make sure the area is clean with soap and water and a cloth. And then after that is all ready, then I would go ahead and set up my sterile field. And this would be above my waist at all times and within my sight. So first, after I remove my clean gloves, then I would wash my hands again and get ready. I would open this away from me first, and there's a 1-inch border that's not sterile, so I would touch that. Then once it's opened, I would get my sterile gloves to the side before I do anything, and I would apply my sterile gloves. This also has that 1-inch border I could use. Okay, so first, then I can fix these once I have these on. And I keep my gloves above my waist at all times. So now I'm going to get the sterile field set up and ready. So first, I'm just going to drape the patient. I'm going to get my field ready and just assess what I have here. So let's see. First, I'm going to make sure that the sterile water is attached to the catheter and ready to go. And then I'm going to go ahead and get my lubricant all out and ready, and then put that away. And then I'm going to get my iodine swabs opened and ready to clean. Okay, so those are out and ready. Then before I transfer this over to the patient, I'm going to put the tip of the catheter just in the lubricant while staying in the sterile field. And I'm going to go ahead and transfer this while maintaining sterility. Okay. So we're still sterile here. Okay, so now before we insert the catheter, we're going to clean the female. So with the female, you would use the iodine swab stick and clean the labia furthest away, throw it away, then clean with a new swab, clean the labia closest to you and throw it away, and then with the last swab, clean the inside, the middle, straight down and throw it away. And as I was doing this, I would have my non-dominant hand right here opening the labia. So this hand is no longer sterile. So now I am ready to insert the tip of the catheter that is lubricated right here. So you just inform the patient that they're going to feel some pressure. And with the male, when you're cleaning the male, you would want to hold up the penis at a 90-degree angle and then clean in a circular motion 3 times with 3 different swabs as well. And if he has foreskin, you would pull that down. Okay, now we're going to insert the catheter, lubricated. So you would go ahead and insert that. You would insert it until you saw urine return, and then you would go 1 to 2 inches more. And then you would just secure that with this hand, and once you saw urine and went 1 to 2 inches more, you would then blow up the balloon and immediately remove the balloon, or the saline, the sterile water, and then you would slightly tug to make sure that it was secure, and all of that looks good. So then we're no longer sterile, so then you would secure the catheter with a stat lock right here on the inner thigh, and for a male it would also be on the thigh, and you would then place the bag on this bed on a non-movable part of the bed. So that would be attached. Okay. And so that is all attached. You would explain to the patient what a normal experience would be and what would be anything to let the nurse know about. So they shouldn't feel an urge to urinate, or if they had excessive discomfort, then they would need to let us know. Yeah, so then I would make sure all of this stuff is cleaned up. I would go ahead and remove my gloves and wash my hands. I would raise the bed to the lowest position and make sure the patient had a call light. I would ask the patient if they needed anything else, and then I would go ahead and document the date and time of the procedure, the reason and the reason for inserting the catheter, and also the size of the catheter, the amount of urine and the color that is coming out of the catheter, and then also the amount of solution that was pushed into the balloon of the catheter. And I would also document the patient, about how the patient tolerated the procedure. Yeah.